Welcome to this edition of the First Aid Show. Falls from height, even small heights, can cause spinal injury. The severity of injury will vary on many different factors. We asked a paramedic to explain more about spinal injuries.
If you have been told that the patient has fallen from a really significant height, tumbled down a full flight of stairs, been thrown off of a horse or out of a car or off a motorbike, and you suspect there could be a spinal injury, it's really important to protect the integrity of that spine. And you will be told when you call the emergency services not to move the patient. If for any reason that patient stops breathing or needs to have CPR, then of course you would roll them gently with someone's help to make sure you could administer that life-saving treatment at the expense of maybe causing some disruption to the spine, because otherwise they're not going to survive. But it's really important that as much as we can, we keep the person in a nice neutral alignment to make sure their spine is safe. We have all the equipment when we arrive. The fire service and the emergency services, we're trained to make sure that we can keep people stabilised and immobilise them safely to protect their spine, and we have all the necessary equipment. But it is something that often requires help and other people, bystanders, to get involved to help move the patient safely to keep them in that nice neutral alignment. Sometimes you have it that somebody's stopped breathing and people just leave them because they're worried about their spine. It is really important that they open up their airway or they take their helmet off. But as a bystander, they'll probably be told, don't do it. But I think in the future that will change, because if you bang your head really hard, you just stop breathing, and you just need to get that airway opened so that they start breathing again.